Mars. Clear around.
Hey, it's Maddie again. I'm going to do my subcutaneous injection. So I'm going to start by reviewing my patient's chart. I have Joanne Peterson, date of birth 12/10/47. No allergies. She has a high fall risk. She was admitted to the med-surg unit. And her admitting diagnosis was dehydration after being found by her son after she had a fall. Past medical history, hypertension and asthma. She is currently on furosemide, 20 milligrams bimodal daily, and albuterol inhaler. 2 puffs as needed for shortness of breath due to her asthma, and acetaminophen for 500 milligrams as needed for pain. She lives at home alone, has 2 kids. Her son's next door, and her daughter is 5 miles away, and she's a retired accountant. Looking in my handoff report, her heart rate is normal, BP is normal, respiration rate is within normal limits, and her O2 is 98 on room air, and her temperature is normal as well. Alert-oriented, rested in bed. She is oriented to person, place, and time. Her pupils are equal, round, and reactive to light and accommodation, and she has no neurological deficits. She has an IV in her right arm. Labs need to be drawn. Lab team's on their way. High fall risk, soreness from falling, but she has no broken bones. I previously did administer her flu vaccine, so that one's good. And now she has another medication on her MAR that is due now. So just looking at these, it looks like she has a heparin 5,000 units per milliliter to be injected subcutaneously daily, and that is due now. So I'm going to go into the room, talk to the patient, see if she can tell me if she has any allergies or not, and then I'll go over the side effects of heparin. Knock, knock, knock. Provide for privacy, hand hygiene. Hi, Joanne. I'm Maddie. I'm going to be your nurse today. Can I have you verify your name and date of birth, please?
Joanne Peterson, 12/10/47.
Perfect. I'm going to look at your wristband. That looks great. All right, so I was just at the nurse's station and I was looking at your electronic medication records, and it says that you're due for heparin now. So that will be administered subcutaneously. So it'll go in about a 45-degree angle into your subcutaneous tissue, and then I'll just do the injection. Do you have any allergies that I need to be made aware of?
Nope.
No. All right. So before I go ahead and get your heparin ready, I just want to go over some side effects you may experience. Potential side effects are hemorrhaging, which is something that we will monitor for, thrombocytopenia, which is a low platelet count that we'll monitor, and then you may experience any allergic reactions, but I'm not too concerned about that because you don't have any allergies that we are aware of at this point, so I think we're okay. So I'm going to go ahead, I'll leave the room. I have your bed in the lowest position, you have your collet, and your side rails are up. Do you need anything else from me, Joanne?
Nope, not at all.
All right. I'm going to hand hygiene on my way out. Open the curtain, provide for privacy. And now I'm here at my MAR. So I have heparin, 5,000 units per milliliter, and we're going to start our med checks. It is intact, unopened, unused, flipped upside down, nothing leaks out of it, and it is not expired either. So I have Joanne Peterson, date of birth 12/10/47, no allergies. I have heparin 5,000 units per milliliter for subcutaneous injection, and it's due now. I'm going to do my second med check. I have Joanne Peterson, 12/10/47, no allergies. I have heparin 5,000 units per milliliter to be injected subcutaneously, and it is due now. So I'm going to gather my supplies, which is right here. I have my blunt needle. I have my 25 gauge, and it's 5/8 inches long, so it's shorter because we're going subcute. And I have my alcohol swabs. Okay, I'm gonna knock, 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 provide for privacy. Hi, Joanne. I'm gonna complete my hand hygiene. How are we feeling?
Good, how are you?
Good. Okay, so just to go over those side effects again before I start with anything, you may experience signs of hemorrhage, thrombocytopenia, which is low platelet count, and then you may experience an allergic reaction. So if you experience anything out of the ordinary that you have not experienced once before, please use your call line and give us a call, okay?
Perfect.
Okay, so I'm going to start by opening my needles and stuff. So there's one. I'm going to open my blunt needle, which I'm going to use to draw up the medication. Then I have my syringe. So I'm gonna start by cleaning the top of my tube. Okay, discard. I'm gonna take my syringe and my blunt needle, and that is on. I'm gonna remove my cap but not get rid of it because I'm gonna recap when I'm done. And I'm giving 1 milliliter. Oh, please hold. That is on so crooked. There we go. Okay, 1 milliliter. So I have 1 milliliter of air. I'm gonna inject 1 milliliter of air. Flip it. I'm gonna draw my medication. Why isn't it working? I'm gonna cap my needle. I'm gonna dispose of this one in the sharps container. I'm going to take my other needle. I'm gonna pull back the safety cap and remove this cap. I have my alcohol swab. I'm gonna come clean my patient. All right. I'm gonna pinch your skin a little bit. I'm going bevel side up, and I'm gonna go in at an angle. Can you see the angle okay?
Yes.
Okay, so I'm going in at a 45-degree angle. I'm going to use a hard surface to cap my needle and dispose. All right. I'm going to hang out with Joanne for a little bit, 15 to 30 minutes, just to see if she experiences any adverse reactions. 10 to 15 minutes has passed. Hey, Joanne, are you still feeling okay?
Yep.
Perfect. Do you have any questions for me?
Nope, not at all.
No? All right. I'm going to make sure you have your collet, your bed is in the lowest position, and your side rails are up. All right, let me know if you need anything. I'm going to leave the patient's room, and then I'm going to document.